All right, let's dive right in. Today, we're looking at a really important joint statement from the World Health Organization and UNICEF. It's basically a global call to action for something that's fundamental to the health of, well, all of us: breastfeeding support.
So the statement kicks off with this incredibly powerful idea. I mean, just think about that for a second. Breastfeeding isn't just food. The WHO and UNICEF call it a baby's first vaccine. It's a natural shield, protecting them against some of the most dangerous diseases a kid can get. It is literally the best possible start in life.
And here's the kicker. Even with this amazing life-saving benefit, there's a huge disconnect. Almost half of all babies under 6 months old aren't getting exclusively breastfed. That's millions upon millions of babies missing out on that first critical protection. So what this shows us is a pretty serious gap. A gap between what we know is best and what's actually happening out there in the real world. But let's get specific. How big is this gap, really? How far off are we from the targets that global health experts have set? Well, have a look at this. The current global rate for exclusive breastfeeding is sitting at just 48%. Now, the official goal from the World Health Assembly is to get to 60% by 2030. That means we have a 12-point gap we need to close, and fast. We are just not where we need to be. Which, of course, brings up the big question. Why? Why does this gap even exist? Well, the report points its finger at one thing: a systemic failure. And this is absolutely crucial. WHO and UNICEF are very clear here. This is not about blaming moms or saying it's just an individual choice. Nope. It's a failure of our systems to give families the support they actually need. It's a deep structural problem. 1 in 5. Just let that number hang there for a second. What does it represent? Well, it's a pretty shocking indicator of just how deep this systemic failure really goes. And there you have it. Only 1 out of every 5 countries provides proper, decent training on this topic to the very doctors and nurses that new mothers depend on. Think about that. The vast majority of frontline health workers haven't been given the skills to help. And the consequences of that? They're exactly what you'd think. You've got millions of new moms being sent home completely unprepared, without the skilled support they need. The health systems they turn to are often fragmented, under-resourced, basically not set up to give consistent quality help. It's a cycle that just leaves families to fend for themselves. But, okay, it's not all doom and gloom. The joint statement doesn't just point out the problem. It actually provides a clear prescription for how to fix it. It's a global call to action. So here's the roadmap they've laid out, a comprehensive 6-point plan. It's all about investing in care, increasing national budgets, integrating support right into routine checkups, and training every single health provider. It also calls for strengthening community networks for long-term help, and, this is a big one, protecting families from the aggressive marketing of formula. It's the whole shebang.
Now, I know what you might be thinking. This all sounds, well, expensive. And with health budgets stretched to the limit, that's a totally fair concern. But this is where the argument gets really, really compelling.
So let's just ask the question head on. Is spending money on this stuff actually a smart financial move for a country? The answer, well, it might just blow you away. $35. Just take that in for a moment. What on earth could this number possibly mean?
This is honestly astounding. For every single dollar a country invests in building these support systems, it gets $35 back in economic returns. 35! That's from healthier people, lower healthcare costs down the line, and a more productive workforce. It's not an expense. It's one of the best investments a country could possibly make.
And that really brings us to the ultimate conclusion from WHO and UNICEF. It's that strengthening these systems isn't just about health. It's about doing what is both right and smart. It is a moral imperative, yes, but it is also a powerful economic imperative. So when you put it all together, the evidence is just overwhelming. The plan is laid out for us, and the economic case is ironclad. It leaves us with one final, pretty urgent question, doesn't it? What are we waiting for?